Service Committee meeting for September the 26th. Appears we have a quorum in place, so we'll take it right to the top and ask you to approve the previous meeting minutes. It's been moved. Second. All in favor? Aye. Is there no opposition? So now pass unanimous. The first item on the agenda, Michelle, she's here. Yeah, I'm gonna ask them to move her out of order to the.
Yes, thank you, Carol. Thank you, thank you, committee.
I could be so far down I can't even find number 20, Michelle. I'm sorry. Okay, let's move. Oh, Mr. Simpson's here. Okay, authorizing agreement regarding moving and storage services for eligible temporary assistance recipients. Michelle.
Yes, we asked permission to have a contract with these two vendors for moving and storage services for our clients who are evicted or burned out or some reason why they have to leave their apartment while they're looking for a new place to live.
Anybody have any questions about this again? No questions? I hear vote. Motion. Second? Second, all in favor?
Aye.
Any opposition? Hearing none is unanimous. Number 21, authorizing agreement with Equinox Inc. regarding non-residential domestic violence services.
Thank you. We're asking permission to enter into a contract with Equinox for some core services for domestic violence victims. This is coming through two federal grants. One is for the 24-hour domestic violence hotline, counseling services, and just to do a safety plan, put a safety plan in place. And then there's a $25,000 grant, which is more intensive case management for clients who need a personalized safety plan and need accompaniment appointments and that kind of thing.
Any questions on this? No question? Do I hear a motion?
Make a motion.
Motion to move.
Second.
And seconded, all in favor?
Aye.
Any opposition? Hearing none is unanimous. And finally, you authorize an agreement with Equinox Inc. regarding residential domestic violence services.
Yes, we're requesting permission to renew an agreement with Equinox for their domestic violence shelter. This is their shelter services for victims of domestic violence. We served 223 people through their shelter during the last contract year. And this is a state mandated service that we provide to the state certified shelter, which Equinox has.
State mandated. Okay, any questions? Doug, go ahead.
Their Equinox is moving into my neighborhood, I understand. They're building a new, on Central Avenue where the old police station was, a new housing project, but it's not shelter, it's residential living. And there would be about 21 patients there, I was told. Is that program hit you yet?
No, that's probably through their mental health services program. We don't contract with them for mental health services. The only contract we have, I believe, is the domestic violence services through Equinox. And this shelter is in a different location.
Different, okay.
Yeah, it's in a secret kind of location in Albany County.
Yeah, I understand.
Yeah.
Thank you.
It's supposed to be secret?
The location is, yeah.
Domestic
you
violence.
can.
Okay, well, it's secret now, huh, Doug? Thanks a lot, then, Michelle. I don't think we have any questions. Do we vote? Take the vote, huh? We'll take the vote.
I'll make a motion.
Motion, second. All in favor?
Aye.
Any opposition? Hearing none, it's unanimous. Thanks a lot, Michelle.
Have a good night, thank you.
Thank you. All right, we take it back to the top, number one. Good evening, Commissioner. How are you?
Good evening, everyone.
Okay, number one. Authorizing agreement with the New York State Department of Health regarding reimbursement for the administrative costs pertaining to the early intervention program.
Yes, thank you. The department requests legislative action for permission to renew a contract with New York State DOH for reimbursement for administrative costs pertaining to our early intervention program. Our early intervention program is services for 0 to 3 population with children who have been identified with having developmental needs, whether it's in this area of speech, OT, physical therapies. And this is a mandated program, and so for the administering of the program, the county is able to receive administrative costs associated with that.
Anybody have any questions about this item?
Make a motion.
Motion is made.
Second.
All in favor?
Aye.
Any opposition? Hearing none, it's unanimous. Number 2, authorize agreement with LaSalle School regarding family assessment intervention services.
Yes, the Family Assessment Intervention Services is a front door service. It's located over at Family Court, and it's really an opportunity for when a youth is pending charges, that there's an opportunity for the FAI specialist to meet with the family and the youth to really identify what are the strengths with the families, what are the challenges, and present a report back to the judge, who will then take that into consideration as to whether or not, with programs and services, that youth can remain in the community, or whether or not there is a need for placement. And so this is one more year. There's one more option to renew on this contract.
Okay. So you mean it's a 2-year contract, this is the first year, you got another year after this one? Okay, any other questions about this contract?
What's the age range of these youth?
We're talking about 11 to 15. Excuse me.
11. Thank you.
15. Any other questions? I hear a motion. Motion's made.
Second.
Second, all in favor?
Aye.
Any opposition? Hearing none, it's unanimous. Number 3, authorizing an agreement with the Parsons Child and Family Center regarding the provisions of clinical provision services.
I would like to make a suggestion for consideration. Items 3 through 15 are all pertaining to our prevention program, so I didn't know if you wanted to consider lumping them all together or taking them individually. That's certainly your discretion.
I don't know, I have a motion from the floor.
I would love to lump this together.
The steak is good. All right, I think that's a great idea.
That's just me.
Motion made. Do I hear a second? Yeah, pertaining to such, you just.
I'm not sure how to take that.
As a compliment.
Do I hear a second on this?
Second.
This is from number 3 to restate the number.
15.
3 to 15. Okay, all in favor?
Aye.
Any opposition? Hearing none, it's unanimous. That's from 3 to 15, all approved unanimously. Okay, so now you go to number 16.
Yes.
Amending resolution number 373 from 2006 regarding additional foster care provisions for children in Albany County.
Yes, thank you. So this is a request to expand the list of foster care providers that we have available to us. Again, we are seeing an increase in the number of children that are coming into foster care, as well as the circumstances for some of these children in terms of whether it's their own behavioral concerns that they might have, whether we're looking at large sibling groups, or whether we're looking at just complex needs because they may have their own mental health concerns. And so really this is allowing an opportunity to expand the number of available resources so that when the circumstance does present itself that we have to take a child into care, that we have available resources for placement.
Are there any questions?
Just a global question. These are all sort of institutional organizations. Do we have many individual foster families in the county?
We actually have a combination. So we do have foster boarding homes, and I can actually say that even though there's been an increase in the number of youth that have come into care this year, we've actually placed more in the lowest level, which is the foster boarding homes. So when we do our recruitment really is about recruiting more foster boarding homes, and we currently actually have a MAP class going as we speak, which we're looking at a potential additional 10 foster boarding homes if everyone successfully completes the program and they decide that they do want to become foster parents and they're able to go through and get certified. So The goal is to have much more foster boarding homes because the goal is to have the least restrictive level of placement, which would be the foster boarding homes.
Good. Thank you.
Any other questions? Your motion? Motion's made. I hear second. Second, all in favor?
Aye.
Any opposition? Hearing none, it's unanimous. Number 17, amending the 2017 Department for Children, Youth, and Family budget to increase costs of transportation for children with special needs.
Yes, we request permission to amend the 2017 approved budget and to increase funds for the special needs transportation. Again, this is one of our mandated programs for our preschool special needs youth who have been identified and approved for programming. And as part of that service, they are eligible for transportation to and from their programs. We have seen an increase in the number of youth that are in those programs. So on the one hand, it's positive to see that there are more youth that are being identified and linked to these services, but then the double-edged sword of that is then we're seeing increased costs in regards to transportation.
Do we have any metrics available at $600,000 package? Do we have any goals to set? How many have completed and been accomplished in this program?
I don't have
You
those
don't have
numbers
it
in
with
front of
you?
me, but I can certainly get them.
Okay, thank you. Can you make a note of that? Okay, thanks a lot for that. Number 17, now number 18. Can we vote? Did you vote?
No.
Your motion?
So moved.
Second.
Motion second. All in favor?
Aye.
No opposition? It's unanimous. Okay, number 18, authorize an agreement with the Research Foundation of the State University of New York regarding the Juvenile Detention Alternative Initiative.
Yes, so this is, Albany County is one of 6 JDI counties that has been working in regards to reducing the number of youth that are entering into juvenile placements. We have seen success in terms of the number of programs and services that we've been able to establish, as well as the collaboration that we've built within Albany County through both the JDI work, the Juvenile Justice Steering Committee, as well as the Capital Region Youth Justice Team, all really focused on how to look at evidence-based practices and really implement programs and services that reduces the number of youth going into placement, or if they do go into placement, how to successfully reintegrate them back into the community. So that's one of the focus of the JDI program. And with having the additional component of the SUNY contract, we're able to track our data and see our progress as to how we are doing with the programs and services for these youth.
Interesting. JDA, that's a good acronym. I gotta remember that one, add that to your list. Any questions?
No, make a motion.
You make a motion?
Second.
And second, all in favor?
Aye.
Any opposition? Hearing none, that's unanimous, Chair. Okay, number 19. Amending the 2017 Department for Children, Youth, and Families budget, increasing the youth placement costs.
Yes, so this is associated with those youth who are placed in OCFS facilities. And actually, in the 2015, 14 or 15 enacted state budget, it actually placed a $55 million cap in terms of costs for OCFS placements across New York State. The challenge with that is you are waiting for your data from OCFS in regards to how many bed days you've actually used. And so your percentage of what your cost is going to be is based on the tally across New York State in terms of other counties and how many bed days that they've used. So to be able to try and calculate what you anticipate your cost is going to be is very challenging because that's not data that's currently shared with us. So within the 2017 approved budget, we estimated what we thought was going to be our anticipated cost in regards to our OCFS placement. And unfortunately, when we received our invoice this year, there was actually a $500,000 increase that we did not anticipate. So as a result of that, we do request legislative approval to be able to appropriate the necessary funds into that line in order to cover the unanticipated costs associated with that.
Sounds good to me. Any other questions about this item? No, prepared to vote? So moved. Is there a second? All in favor?
Aye.
Any opposition? Hearing none, unanimous. Thanks a lot, Gail. We'll get that information out.
Thank you.
Thanks for coming. Okay, the next one on the list, 23, skipping down. Scott Siegel's here. Good evening.
Good evening, Madam Chair. How are you?
All right. So I'm authorizing the acceptance of grant funding and an agreement with the New York State Office for the Aging regarding the health insurance information, counseling and assistance program.
Yes, ma'am. The department's been notified of our allocation for the 17-18 program year. Finally, better late than never, I suppose. But we are asking permission to go ahead and accept that funding and put it to good use.
We like grant money, we will take it. Any questions for Scott? Yes,
No,
Paul?
no, I was gonna move it.
I think you just waving.
Yeah, waving.
One move, do I
So
hear a
moved.
second?
Second.
Second and all in favor? Any opposition? Hearing none, it's unanimous. Thanks a lot, Scott.
Thank you very much.
Next one is Larry Slacky's coming in from the nursing home. Good evening, Larry. Larry, I saw you yawn. Are you all right? You're good. Okay, well, we'll wrap with you at number 24. Authorizing agreement with Zamat Healthcare Services Group regarding case management review services at the nursing home.
Yeah, Zimmet has been there for 3.5 years now. This is the last year of their 3-year contract. They're responsible for auditing our minimum data set, which is called MDS. They've been responsible to assisting our staff in education, documentation that wasn't in existence really before they arrived. So our case mix has gone up from 0.77, which was the lowest in the state, to over 1.0 right now, and we still could grow probably another 5–10% hopefully over the next couple of years. And so far, I think they've increased with the case mix index, which is called the CMI, probably around $1–2 million a year.
Are any questions about this? Madam President? Do I hear a vote?
Make a motion.
Motion's made. Second. All in favor? Any opposition? Hearing none, it's unanimous. Number 25, authorizing agreement with the New York State Industries for the Disabled, Inc. for linens, rentals, and residential clothing laundry.
Approximately 3 years ago, we closed our laundry and retained the services of New York State Industry for the Disabled. We subcontract our linen service for regular linens and resident clothing. We negotiated a contract in the middle of this year with them, and after that negotiation, which was presented here, they agreed to keep those rates for the next 3 years. So from 18, 19, and 20, there'll be no increase in linen laundering, rentals. This is a 3-year agreement, and because it's through this agency, an RFP was not required.
Do I hear a motion? Do you have a question, first?
When it was done in-house, Larry, is there a comparison on the cost that?
Oh, yeah, we cut the cost probably, I would say conservatively, around $300,000 a year. Now, it needs to be noted that when we closed the laundry, we moved 7 FTEs from the laundry to the nursing home.
Okay.
Those 7 FTEs are still there and budgeted. If we didn't do that, we would have kept the laundry open, had those 7 FTEs, and would have had a higher 7 FTEs to bring the housekeeping department up to appropriate staffing levels. They were really half of what industry norms were. And there were many reasons for that. When we closed the laundry, we were able to move all those staff members into the nursing home, bringing our staffing levels to what they were supposed to be. And now I think as most people that visit the facility do comment that we actually have a clean nursing home.
Okay,
So moved.
okay. Are you prepared to vote on, you make a motion? Motion's made and seconded. All in favor?
Aye.
Any opposition? Hearing none, it's unanimous. Number 26, authorizing agreement with Point Click Care Technologies, Inc. regarding electronic medical records and financial software. $425,000 contract.
Yes,
Now, this is a finish up from the other contract that we ended from Lentech LLC, that was a 5-year contract, kind of doing a similar thing?
Well,
Right. Or
there's a
you
little
explain
bit
it
more
to
to it than that.
Okay,
but-
help me.
But the answer is yes and no.
Okay, give me the guess.
Number
part
one, this
first.
is a 5-year agreement for $425,000. The first year has a little bit more dollars into it, and this was done through the RFP process. Our current company, Lintech, which is in probably their 3.5 years of a 5-year agreement, has really not delivered the mandated items within their contract. We're now discussing these matters with our legal department, Eugenia, and with Karen Storm. We're going to exit that agreement. That agreement was paid for upfront, $300,000 that was submitted to the New York State Department of Health for capital reimbursement, all of which was actually approved, and we're getting now in our Medicaid rate. So there is a little bit of a disparity, but we budgeted for that disparity in the 2018 budget to compensate for any difference. And this contract is approximately, on an annualized basis after the first year, a little over $70,000 a year. But that's for financial software and clinical software. And there's a mandate by the CMS, feds, and the state that by March 31st of next year, we have to have an EMR, and we don't have one. So
What is an EMR?
This is one of the best companies on the market today, Point Click Care. And everyone was involved this time, from the IT department, management and budget, nursing department, finance department. This is the right company for us now.
Now, is this the one where we had to hire an out-of-county person to be trained to learn this process in the Medicaid department at the nursing home? Is this the
No.
item? No, it isn't that, okay, but they had to train, they had to do some training.
There will be training here
There will
with this new
continue to be
system.
training, okay, that's
And
good.
I want to point out that we validated with the company that all the hardware that we purchased
Yes.
originally is still good and fine, and it will be utilized with
We'll
this new
keep it,
software.
Okay, Paul.
Just a quick question on the, when I heard you talk about EMR, is this going to be like the, St. Peter's and Albany Med, where all the records are linked and it's a seamless transference from your provider to the institution?
Eventually, that's the goal, and that's why it's a mandate by March 31st. They will be what's called these RIOs and different organizations that will join together and utilize all this data through one database and be able to share the information. So if we have a resident at our nursing home and it goes to Albany Med, they'll be able to look at our medical record and vice versa, so that there's total transparency in the care that needs to be delivered.
So, and you expect that will be in place in March, or
No, I expect that the EMR will be up and running in March. The coordination of all those other services, whether it be laboratory, pharmacy,
Yes.
radiology, Albany Med, St. Peter's, all of those will take a few years to get everything
Okay.
up and running.
Yes, Joey.
I've been working on that for 10 years.
Yeah.
So the prior vendor that you had to expend the $300,000, so you're dealing with the fact that they couldn't deliver the service you paid up front,
Right.
dealing with the legal. So you said that expenditure was a capital cost that was folded in your Medicaid rate. Is that what
Correct.
you said? So are there ramifications because that expenditure now is essentially a
That's what I
disputed-
mentioned, that there will be an adjustment made
Okay.
from what they're giving us versus what we're spending now. The
Okay,
difference is that was a capital expenditure.
right,
This is not a capital expenditure.
okay,
So, because we paid for it up front, we were able to capitalize it. This is being paid for as a lease over years, so it's a different reimbursement.
okay,
So that reimbursement, from what we've checked so far with our accountants, will not be taken away because it'll be offset by this expense, because we're getting it in our rate.
okay,
Where legal and purchasing are still looking into some of those deliverables. We bought the financial package as an example, and we use it and it works, but it's not what we need it to be. It's not totally integrated into our system.
okay,
The EMR, we don't have, but we do use their MDS software
okay,
and the submission. So it's not like we don't use any part of it and it was a total waste. but it is not giving us what it needs to give us to produce the product that we want.
Okay, so you have those sort of adjunct, like assessment and finance pieces set up, it's just the,
Some of it works, some of it doesn't work, some of it doesn't talk to each other. Getting our submissions electronically sent up to the state, which we have to do, our MDSs and the feds, rather really the feds. It's not compatible to what it should be for the mandates of the feds in how it's supposed to get up there.
right, and
And-
the mandate is a March?
March
mandate?
31st of next year, the EMR has to be up and running. And with the schedule that we have in place with Point Click Care, we're pretty confident that we're gonna be able to do what we need to do. They're in thousands of facilities, not hundreds,
Right, right.
thousands across the United States.
So, and I assume
Lin-
many nursing homes use this vendor?
Many, I would say, I'm guessing over 1,000,
Okay.
maybe more. I mean, it's 18,000 nursing homes, they probably have 25 to 30% of the industry.
Okay. And is the nursing home a member of our local Rio?
No, not yet.
Okay,
These are things that we really need to do.
Okay.
We've really been outside looking in,
right,
and these are the things that we have to do, whether we haven't participated in ACOs, RIOs,
right,
you know, all of the above. You
right,
know,
but
we
the
only-
Rio
we
will
actually
cost
make-
the nursing home something. I mean, that's one of the reasons
That's
why.
right.
Do you
What-
know, are you gonna put that money in the 2018 budget?
Everything that will surround this software and integration is in the 18 budget as we speak today.
Okay.
If something else comes up that we don't know about, that Disrupt is dealing with in Albany Med, you know, we're not sure. But right now, this will cover all of our software needs, both financial and clinical.
Okay.
Another question? Concern? So Karen Storm and Regina Condon from our legal department are going to be following this all the way to completion.
Yes, Laura Vartanian
Vartanian.
has been dealing, she's, you know, heads this up, and she's been speaking with Eugenia, and we're going to have a meeting, hopefully the latest next week, because we want to make sure that everything's in place to make the transition from one company to another, because they still have and will have part of our data, just like the previous company.
Right.
So there has to be a mechanism for us to get our MDS data, you know, downloaded and uploaded into our new system.
Can I just ask one more
Certainly.
question? So is the Point Click vendor familiar with the prior vendor, their capacity and their platform?
They're familiar with their software and, well, I don't know all the numbers, how they tie in when you look at it as a computer upgrade or integration and creating, so they can talk to each other. But we put 100% of that, this is, you can see, this is the
Right.
RFP. We put every single possible thing in there that vendor had to do for us, because we learned over the last 3 years. I mean, the money really wasn't wasted. When we made the decision in 2014, we really didn't have the knowledge that we have today. And the RFP could have been more enhanced, you know, it just wasn't what it needed to be, but they were working with what the knowledge that they had at the time. No one did anything wrong, but now we're pretty sophisticated now in what we know. And we didn't use our IT department when we did our last RFP, and some of the finance people down at 112 State Street, all of those individuals were now involved in this RFP. So it's a solid RFP, and I think the company, the companies that responded did a pretty good job in answering what we needed to have answered.
Thank you very much. Do any more questions or concern? And then speak about the new Point, what's it called, Point Click here. And everybody satisfied with that? The new
Yeah.
people coming in?
So moved.
Okay, so move. All in
Second.
favor? Any
Aye.
opposition? Hearing none. And we'll be following up with Eugenia
Yes, definitely.
and Laura. Thanks a lot. for
Thank you
coming
very
down
much.
this evening. Motion to adjourn? Second.